Michael Carter is sitting at the dinner table having dinner with wife Sarah and their 15-year-old daughter, Emily. Suddenly, he grabs his chest. His breathing becomes heavy. "Dad," Emily whispers. Michael collapses onto the dinner table. "Michael, stay with me!" Emily's calling. 911! Please, my dad can't breathe!" Within minutes, the sound of sirens echoes through the neighborhood. Paramedics burst through the front door. "We've got him." Ambulances rushes to hospitals, taking Michael to emergency room. Family terrified. Sarah can't barely breathe, holding her daughter. Miles, "Your husband is going to be okay." Sarah breaks down in tears. Emily hugs her father tightly. Everything feels perfect, until a plain white envelope arrives in the mailbox. Sarah opens it. Her smile disappears. Total amount due, $58,000. The room falls silent. They survived the heart attack, but how are they going to survive this? How can this happen in the richest country on earth? Every year, America spends over $5 trillion on healthcare, almost 18% of its entire economy. Yet millions of Americans still ask, "Can I afford to get sick?" America has some of the best hospitals and doctors in the world. So why are Americans terrified to call an ambulance? Who is the culprit? The answer isn't simple. Hospitals, insurance companies, drug manufacturers, employers, and government programs all play a role. Insurance company. Imagine paying hundreds of dollars every month for insurance, believing you're protected. Then you get sick. Suddenly you're dealing with deductibles, co-pays, coinsurance, and out-of-network charges. Sometimes it feels like you need a translator before you need a doctor. Even more surprising, the exact same surgery can cost dramatically different amounts at two nearby hospitals because prices are negotiated behind the scenes. The drug manufacturers. Prescription drugs tell a similar story. Many medicines cost far more in the United States than in other countries. Drug companies say those prices fund life-saving research, while critics argue too many patients still can't afford essential treatments. The politicians. Every election, politicians promise to fix healthcare. The slogans change. The speeches change. But one question never seems to disappear. Can I afford to see a doctor? Imagine a single mother finding a lump. She wants to see a doctor, but she waits. Not because she isn't worried, but because she's terrified of the bill. America leads the world in medical innovation, and those achievements are real. But so are the stories of families drowning in medical debt. Because when someone is fighting for their life, the last thing they should have to fight is a bill. Sometimes the second battle doesn't happen in a hospital. It arrives in your mailbox.